Imagine you are all doctors who over the years of your career realized that something was wrong. You realize that what you did with your patients did not improve people's health, but the condition of their illness. You realize that the method of your working were palliative and invasive. And that, my friends, is what happened to the Dr. Paulo de Tarso Lima. This man believed in a renewing and integrated form of medicine and brought this idea to my home country, Brazil. And maybe you were wondering, but what is integrative medicine? How could this kind of medicine help us? Well, before saying that, I will ask you to answer some of my questions. So, if you already passed through these situations or saw this happening to someone else, please raise your hand. Okay. First situation. Imagine you are entering a hospital, clinic, or health institute and knock on the door. And you hear the professional say, "Come in." And then you come in and realize that no one even looked at your face when you did that. So please raise your hand if you already saw this happening with you or another one. Okay. And the second situation is based in one of my mom's story. My mom is a doctor. And one day I was talking to her about her job. And she told me that in hospitals, it's very common. The doctors refers to the patients as their respective diseases. And when she told me that, I thought that this situation should not happen. And that's the reason for my passion and interest for integrative medicine. Integrative medicine is a practice of medicine that reaffirms the importance of the relationship between doctor and patient. It's a science that talks about spirituality. The doctor's view of the patient is no longer based on the disease. The doctor sees an individual with soul, body, and mind who has the capacity to act in their own healing. And having said that, the doctors stop focusing in one specific problem. They treat the body as one thing. And all the wishes of the patients are important for treatment and seek to be fulfilled as a way of welcoming sick people. So that's because we can feel physically, mentally, emotionally better through this process. It's because we start paying attention to that. So we start thinking, hey, we're all different. We have different difficulties, different opinions, different virtues, different wishes and goals. So one treatment may work with me, but it may go wrong for the next one. So if you are sick, you're not supposed to lie down and receive passively the treatment. You and your doctor should think and investigate together what happened, why you got sick, and how you can overcome that, how you two can overcome that together. So we are no longer an ill body that can get ill again. We start thinking how we can never pass through that again. The individualities of each person are taken into account. So the methods used in this practice of medicine are not just alternatives to the traditional medicine, are fundamental to complete it. And some examples of these methods are acupuncture, meditation, relaxation, physical exercises, dietary, education, and all of them require a scientific proof. So all of this that I'm saying to you consists in a humanized vision. What human organisms be if were not the systems that compose it? And what would the systems be if were not the organs that make them up? And how we could have organs if we did not have the tissues that form them? And how our organs can be stimulated to produce specific substances without the glands? And what would the central nervous system be if you are not the nerves that binds it to the rest of the body and allow us to capture and interpret information, and consequently allow us to form who we are, what we want, what we need? So all of my speech is a reminder to you, a reminder that we're strong enough to deal and to work with our pains. And we're brave enough to demand for more integrative medical treatment because we are integrative beings. We're not perfect bodies, and we never were, never will be, and we're not diseases, and we cannot be called that. Thank you.